Annual conference among Exxon, NASA, and Houston Methodist Hospital tackles issues where science, engineering, and medicine all converge.
And this year is pretty amazing since they're wrapping their heads around how to send humans to Mars. Health reporter Haley Hernandez talked to NASA and Methodist doctors about that adventure. She's joining us now in studio with much more. Haley?
If you think about it, the operating room and space exploration have a lot of similarities. Among many, both are looking for ways to expose people to less radiation. And by using each other's toolbox, it could mean that an astronaut will be headed to Mars soon.
From the cath lab to Mars, Dr. Alan Lumsden says finding a way to limit the effects of radiation will allow both surgeons and astronauts to work in a safer environment.
You take a cardiologist who is being exposed to radiation 3 to 4 hours a day, 4 to 5 days a week. For 30 to 40 years, there is increasing concerns about the amount of radiation that the proceduralist gets exposed to, and also to patients, because we're using more and more and more imaging.
Nobody knows that better than Dr. Edward Dietrich, one of the world's blood vessel experts, who no longer goes near this equipment because he says the radiation gave him a brain tumor.
So I was being radiated from dusk to dawn, not even thinking about it. So it wasn't until all this kind of struck me at once, I began to realize, and was then actually asking myself, what's the etiology? What's the cause of this? I'm convinced it's radiation.
And that kind of radiation gets multiplied when you leave Earth. NASA wants to send an astronaut to Mars, but one of their top concerns is radiation exposure, which makes a human Mars landing impossible.
Are there medicines that they're coming up with that can help prevent the body's susceptibility to radiation? All of these things are being worked on here in the medical center, problems that we need help with at NASA.
And right now, these medical and space experts are working to create a world where surgeons and astronauts are protected from radiation, which would then mean advancements in technology and medicine like we've only seen in movies. Bill and Lauren?